Welcome back to Yahoo Finance Live. Just about 44 minutes to the closing bell, but we want to talk about COVID-19, the impact we all know that it's had on the United States, but now some positive news specifically about the Pfizer vaccine. To discuss this, let's invite into the stream Dr. David Katz. He is Preventive Medicine Specialist and True Health Initiative President. We appreciate your being here. Very simply, what did we learn about the Pfizer-BioNTech vaccine and its ability to protect us today? What did they tell us?
Well, I think the news is that the vaccines available, Adam, seem to have broad protection against the strains in circulation. Not terribly surprising. These are all variants on a theme. And, although it's reasonable to worry that there could be extreme mutations of this virus that will make them navigate around the protections we have, it's relatively unlikely. Most mutations result in incremental change in the virus. So the latest news is that essentially all of the available viruses seem to offer a robust degree of protection. And we also know pretty clearly now that people who have been over the infection, that's a sizable population, just need one dose of any of the available vaccines to achieve the same level of immunity that would be produced with two of the Pfizer vaccines or two of the Moderna vaccines.
Dr. Katz, according to the CDC data, 18% of the population has received at least one dose of the vaccine. Now we have J&J in the mix. We have 3 vaccines that are being administered. What's your expectation just about when we're going to likely reach herd immunity?
We may be pretty close now, Seana. There are numerous contributors to that. First, everybody who's had a significant exposure to this virus likely has immunity. And some of that we can measure in antibodies, but some of it we can't. Some people fought it off without making the IgG that we measure routinely. Some people have memory T and B lymphocytes that fought this off. When we add it all up, people who have infections we know about, people who have infections we don't know about. And by the way, there have been estimates, including from the CDC, that 5 to 10 times as many people have been infected as we've been able to document. And we now start vaccinating people at a significant level. The light is definitely at the end of the tunnel. I think we're pretty close. There have been predictions that we'll be reaching herd immunity nationwide next month. I'm reticent about a specific prediction because every time I've made one, the pandemic has fooled me. I've been humbled. And frankly, most experts I respect have been humbled by the pandemic. You make very specific predictions, you're proven wrong. We're clearly getting there. And it's a combination of factors. It's people recovering from the infection, plus the vaccines, plus a much higher level of infection, symptomatic and asymptomatic, than we've documented. So we're nearing the end of the tunnel, and there is a light there.
Two-part question. Can you just clarify? I get confused between like Dr. Fauci, and I think I heard you say that one shot of the 2-dose regimen is sufficient to protect. I thought Fauci was saying, no, you still got to get both. And the reason I ask that is because we have a lot of people who are considered obese, and we're finding that there should be perhaps greater emphasis to get them inoculated.
Yeah, Adam, it's a topic I want to talk about, although not so much specific to the vaccine, although it's relevant there too. So to clarify, one dose of any of the available vaccines. And by the way, I agree with Dr. Fauci. The recommendation for which vaccine is whichever one you can get. But the J&J vaccine is a conventionally made vaccine, one dose and you're done. The other two, Moderna and Pfizer, are 2 doses unless you've had the infection. So there have now been a couple of good studies showing that people who've had the infection recovered. By the way, I'm in that camp. I have IgG to this virus. I just need 1 dose of the vaccine and the same level of immunity is achieved. So essentially infection plus 1 dose of vaccine is at least as good as 2 doses of the vaccine. On the issue of obesity, Adam, first of all, it's been pretty clear for a long time that it's a risk factor for bad COVID outcomes, increases the likelihood at any given age of hospitalization, needing the ICU, or dying. Well, if risk of bad outcomes is a reason to allocate the available vaccines, then clearly obesity deserves to be on that list, along with age, presence or absence of diabetes, coronary disease. It's a risk factor for bad outcomes. We should be risk stratifying the distribution of the vaccine. But there's another issue here, Adam. We know how to fix obesity with diet and exercise. We know how to fix most of the cardiometabolic risk factors that massively increase the risk of bad COVID outcomes. And oh, by the way, fixing those would be good for people with or without this pandemic. So that's really a critical issue I don't think has gotten nearly enough attention. We now have an acute case for chronic health. I don't think there's ever been a better time or a greater motivation to have a dialogue about a national health promotion effort. America runs on junk food. We have hyperendemic, obesity, diabetes, coronary disease. All of that's bad with or without a COVID pandemic. But what the COVID pandemic has done is make all that chronic baggage an acute danger too. I think this is a teachable moment. And I haven't really heard nearly enough about that. And I'm hoping that's the next topic taken up by President Biden's task force on this issue. Hey, we have a really good reason to think about getting healthier together. Let's start exploring ways to do that.
And Dr. Katz, speaking of exploring ways to do that, I think you and I talked about that the last time you were on, but any developments on that front? Because as you mentioned, the pandemic has really taught us so much just about the danger of obesity when it comes to a disease like this, and also just the urgency that you've been talking about that this issue needs to be addressed.
Well, Yahoo Finance, Sean, is an interesting place to address the question, has there been progress on that front? Because, the simple fact is America does run on Dunkin' and, sugar-sweetened beverages are the national hydration choice. There are massive profits made in the propagation of obesity and chronic disease. So we have a cultural reckoning we have to deal with. We have to decide if we want to essentially shift away from that and put public health, future health of our children, ahead of corporate profits. But, big food runs on the propagation of obesity, chronic disease. Big pharma is treating an awful lot of disease people never needed to get. There's a pivot there. And I think we do need high-level leadership. I don't think it's a mystery how to fix this. We've got all the necessary tools and resources to fix this. I don't think our culture has ever tried. I think we talk about trying to fix obesity and chronic disease, but I think the status quo is deriving significant profit from it. We have to overcome that.
Dr. David Katz, preventive medicine specialist and True Health Initiative president, thank you for joining us.